Looks like we've got everybody in. Scott, I'm going to start it in like 15 seconds. Welcome to the Mendocino County COVID-19 update. Today, we are pleased to be joined by Mendocino County Health Officer, Dr. Andy Coren, who will give an update on the COVID-19 status of our county. After that, we will open it up to take a few questions from the media concerning the COVID-19 incident. If time allows, we will also take questions from the public. If you're a member of the public, please leave your comment and the question below of this video, and we will do our best to address it. Now, beginning with our health update, Dr. Andy Coren, you have our attention.
Hello, Mendocino. There has been an increase in illness, hospitalization, and deaths in the United States and worldwide as of August 1st. The highest case numbers and deaths are in the United States. In California, the total cases are also increasing. Kirk, can we have slide 1? In Mendocino, from April, our average case rates increased from 2 per day to 14.6 per day. This actually is getting close to the surge that we had over the winter months. Last week, we had 21.4 cases per 100,000 per day. And according to the CDC, this is among the highest transmission levels. This week, we will probably have 30 new cases per day, which is similar now to the last winter. And it's interesting because this is now involving predominantly only that portion of our community that is unvaccinated. Can we have the second slide, please? Lake County is actually, here are the numbers that we've seen since April, and these are weekly case rates, the end of July, and it's gotten steadily worse in the last week. So the next slide, I think, shows us, it shows where we are, and we're consistent here with the other counties in California. What is interesting is that Lake County is significantly higher than we are, and the area in the yellow is not confirmed data yet. It's too soon to be confirmed, but that's what's happening with our neighbor. Hospitalizations follow cases, and the rates are again approaching what we had last winter. In red are the cases, and in blue are the intensive care unit cases, and you can see that they're very close to what we were experiencing back in December and January and coming down in February. The hospitalizations in July ranged around 11 with 2 to 5 in the intensive care unit. On August 5th, just yesterday, there were 16 residents of Mendocino County who were in hospitals. 9 were in med-surg, 7 in the intensive care unit. We had 3 out of county. Yesterday, we also suffered our 53rd death in our county. This person had severe comorbidities. The next slide will show the relationship of vaccinated versus unvaccinated people. And as you can see, there's an 8-fold difference in disease incidence in cases between the people who have been vaccinated versus the unvaccinated in green. When it comes to hospitalization incidents, there's a 25-fold increase in the people who are unvaccinated versus fully vaccinated. And in the incidence of death, there is probably more than a 25-fold increase, but this is related to those who have been hospitalized. In Mendocino County, 88% of our cases in Mendocino County are unvaccinated. 99% of the symptomatic cases are unvaccinated, and over 95% of hospitalized cases are unvaccinated. There have been no recent outbreaks, but there have been high-risk exposures, notably in retail and restaurants, oftentimes with employees unwittingly going to work while infectious, sometimes mistaken their symptoms for thinking it's a common cold or allergies. And I want to encourage everybody to remember that if you're sick, please stay home. And if your employee is sick, please get them tested and don't let them spread this to the rest of the community. This Delta variant is now confirmed by whole genome sequencing in Mendocino. It takes a long time. It has taken a long time to get that information back. We're seeing it really as a very different disease. It is much more contagious due to, and if you could put on the next, oh, here it is. transmission, but also the incubation time to transmission is 2/3 of prior variants. The spike protein is stickier, allowing easier cellular invasion. And nasal viral load counts are 1,000 times greater than prior variants in both vaccinated and non-vaccinated patients. And the other thing that's new is that fully vaccinated people can pass the infection to others even without symptoms. And these are what we would ordinarily call carriers. So on the slide in front of you, the left hand shows the fatality of various different other viral illnesses. And you can see where the horizontal line shows the average number of people who are infected by each sick person, what we refer to as the R0 or R effective. And the original version of coronavirus one person would infect somewhere in the range of 2 or 3 people. The new Delta variant, the pink box, shows that these are infecting each person in the range of 5 to 8 people, along the lines of chickenpox, one of the most infectious respiratory diseases that we've known, and also measles is out even further, that spread faster. Let's see. The other information is that the Delta variant is more virulent with increased hospitalization rates, ICU, and mortality. We are also now in the midst of the summer with the fall and winter influenza season upcoming, and our RSV, respiratory syncytial virus, another seasonal infectious epidemic that usually comes on in the fall and affects the youngest of children, but sometimes elderly people, has already begun. Our testing has jumped up this week from less than 100 per day to some days over 400, and that's very good. It gives us an early indication that people are listening up and they're very concerned about their interaction with this new disease. Vaccines remain our most important protection. They are safe and extremely effective against the severe disease, hospitalization, and death. So we have this in front of you. This shows the numbers of people in green who are fully vaccinated. In the red are the people who are non-vaccinated, and the orange slice 9.3 are those people who are partially vaccinated. And when we move over to the right pie chart, it shows that of those who are unvaccinated, 8.1% are partially vaccinated, I'm sorry, this should show, we don't have the slide up that shows how many have gone more than 60 days at this point. So this shows of the total population, those people who are not eligible for the vaccine, in gray, those people are fully vaccinated, the partially vaccinated in orange, and that's what this slide shows. As of July 31st, our county has dispensed 93,690 total doses, and 61.6% of our eligible population are fully vaccinated. 53.8% of the total population are fully vaccinated. That includes the ineligible people as well, the total population. 70.9% of the eligible population have had at least 1 dose. From an equity perspective, Mendocino County continues to exceed the state among the Hispanic population and also the 50 to 64-year-old group. People are now seeing how safe and effective the vaccines are, and they're beginning to get vaccinations at a little bit higher rate. So we hope that that continues. So what responses have there been to the Delta variant in the past few weeks? On July 23rd, I strongly recommend that everyone wear a mask indoors or in outdoor crowds. On July 26th, the CDPH mandated that all employees in acute and long-term facilities, clinics, and congregate care settings must wear medical grade masks, and in acute and long-term care facilities, employees must verify vaccination status, and all unvaccinated employees must test once or twice weekly. We just learned that Adventist Health will require all employees to vaccinate by September 30th. with narrow exemptions will be permitted, and those will be tested. Today, Mendocino will release orders for mandatory masking indoors in public places. On August 5th, just yesterday, CDPH released new orders that mandate that all healthcare workers must show proof of vaccination by September 30th, and there will be narrow exemptions for religious beliefs or with a written medical exemption. And for those people who are exempt, regular testing will be needed to allow them to continue working in those facilities. Additional orders that are planned for Mendocino County and have been supported by the Board of Supervisors on Tuesday, August 3rd, are being drafted. One includes an order for Mendocino County Fire, EMS, and first responders to verify vaccine, for unvaccinated to have frequent testing. And this is an order similar to Sonoma County, and they have just released that. Note that vaccine verification at this point is very well defined and is different than self-attestation. So that is going by the books on many situations. The other order that will come down will be guidance, strongly recommending that all employers in Mendocino County develop and implement human resource policies to require vaccine verification or frequent testing for employees. There is also new advice from the CDC regarding quarantine. I think everyone should be aware of. Fully vaccinated people who are close contacts, although they do not need to quarantine after close contact, they should test at 3 to 5 days to see if they have converted to become infected, in which case they should be formally isolated to protect others at work or in their households. So in summary, COVID Delta variant is a different virus, and it is swarming through our community with increased cases, hospitalizations, and deaths. Our hospitals are beginning to show some stresses in staffing. 88% of the cases and almost all severe hospitalized cases are among the unvaccinated, and they are generally a younger population. Our vaccination rates are increasing slowly, though they may be accelerating according to last week's data, as some holdouts are saying, well, now it's time, and I can see that it's safe among my peers. Testing has gone up extremely well in the past week, showing people's increasing concerns. Health officers from CDC to CDPH to county health officers are trying to respond quickly to head off this pandemic and save lives. There will still be those who resist rules, the masks, and the vaccinations, but people have learned a lot about all of these, as well as non-pharmacological interventions, and they're taking precautions much more responsibly on their own. We want to do that without closing down the economy, recreation, or schools, and we are relying more on individuals to protect themselves with the lessons they've learned last year, and I believe that that can be done. And that is all that I will offer today, and I'm here for questions.
Thank you, Dr. Coren. First up is going to be KZYX with Sarah.
Okay, can you hear me?
Yes.
Hi, thanks for doing this. So given that we do know a little bit more about the virus than we did when it first came upon us, I'm wondering if you have any plans for some more targeted shutdowns, since so many of them, the exposures are happening in restaurants and retail. I'm wondering if you're thinking of something a little more stringent, but more targeted than the complete full-on shutdown that we just came out of a few months ago.
So I will be listening closely to what the advice of the CDPH is. I don't think any of us want to do shutdowns. We want to see how well the current approaches protecting our healthcare institutions, our emergency services, and how businesses can actually implement policies to protect themselves, and individual people can protect themselves. But I don't think we want to continue with a program of shutdown. So if that becomes necessary, that'll be considered.
Okay. And I have a little bit more of a scientific question for you. I'm wondering what you believe will happen if this virus continues kind of unchecked among high numbers of unvaccinated people. Can we expect the virus to keep mutating? And if so, what can we expect from future mutations? Or will it just, is the trajectory expected for it to just kind of die out on its own?
At this point, I don't know if we're going to see it die out. I think it's going to whip through the community of vulnerable people. And now we're finding that even those of us who are vaccinated have some vulnerabilities and pass it on to others. Viruses that multiply are going to mutate. That's just nature. And as they do, the ones that are stronger will start to predominate in our genome testing. The characteristics we look for is transmissibility, virulence or more severe disease, and also the vaccine escape. And we have not seen the vaccine escape at this point. The increased numbers that we're seeing in people who are vaccinated is because there are so many people that are vaccinated. We're seeing those numbers go up, but they are still very well protected against severe disease, hospitalizations, and deaths. So at this point, it would be nice to have a vaccine against the Delta virus that's in development, but I haven't seen that yet. And I think we're going to have to keep attacking this, and it's a very capable virus.
Thank you, sir. Next up is going to be Matt with KMUD.
Hey, Doc. Hey, guys. Thank you for holding this. I'm hoping you can address a statement you made at the Board of Supervisors on Tuesday, Dr. Coren. You said one of the true consequences of failing our COVID-19 efforts is the possibility of having to close schools, recreation, and businesses. And I'm assuming we're going to be following guidance set out by the California Department of Public Health for those closures. What I'm hoping you could identify for Mendocino County residents is what metrics are going to be utilized to make those determinations to close those sectors, so we can kind of watch how those metrics are tracking.
Well, I will depend on CDPH and the CDC. One of the big issues we have coming up is the opening of schools, and the lessons learned from last year from closing schools is that it's much worse to have the schools closed than open. There was not as much transmission within schools or illness as a result of that in the past. And hopefully that will not be changed as we do it this year. But the teachers have been well vaccinated in our community. We do have, going back to school, a universal masking, and we'll be testing a little bit more regularly within the schools, both the staff and the children. And so if we see numbers continue to go up and we cannot control them with other methods of control, for example, more distancing, a little bit different. We've made some changes in quarantine, and we're trying to keep the schools open by not having such long and involved quarantines. If we can't do that, if there are outbreaks in schools and in multiple classes and multiple schools in a district, then we would have to consider whether it's safer to have them in or out of the schools. As far as the business sectors, I think we look very closely at what's happening in restaurants and physical fitness areas, because those are some of the highest risk areas. We have had a number of people who have been infected in restaurants, and even some who have been servers in restaurants. And what our policy of letting the community know when they've potentially been exposed, and we can't track them down individually, seems to have been working. So we haven't had those explode into outbreaks. But if that tends to happen more, then that would be another reason for us to be leaning toward closing certain sectors. Like I said before, we really don't want to do that. We want the community, the businesses, individuals to be taking more responsibility with common sense, non-pharmacologic interventions, and getting vaccinated. Remember, this is a disease among the unvaccinated. So if people get vaccinated more and everybody is sort of protecting themselves, I think that we will get it under control.
Thank you, Doc. One more question. This idea that it is a virus spreading within the unvaccinated populations. sort of in tandem, you're hearing these breakthrough cases associated with COVID-19 and vaccinated individuals. I'm wondering if you could speak to how many of, or maybe what percentage of recent positives the county is experiencing have been breakthrough cases?
Kirk, do we have a slide on that we could bring up?
Sure, we have a slide.
We're actually trying to get away from the breakthrough concept, which suggests that the vaccine is not working. The clinicians and so forth at the state are saying, well, it is working. It's keeping people out of the hospitals and keeping them from being very sick and dying. So among our current people who have had breakthrough vaccinations or post-vaccination infection rate, we do have a very small number in all of them. The large number is in J&J, Johnson & Johnson. Next is Pfizer, and then Moderna. And the average is 0.238% overall. So that is less than one, it's 2 per 1,000, let's put it that way. Our post-vaccination infection rate. And then if you look at the graph on the right, you can see that there is a slow increase in the numbers, and it seems to follow the increase in numbers of vaccinated people.
And let me put up the one for total numbers here. That might help as well.
Another one would be the one shared from CDPH that shows the relationship of vaccinated versus unvaccinated, but that may not be exactly oh, here we go.
These are Mendocino County numbers.
Oh, good. Okay. So you can see that on the left are for people who are fully vaccinated. We've had 106 symptomatic post-vaccine cases, and a little bit more in Pfizer than in Moderna. But remember that in our county, a whole lot more Pfizer has been distributed, in part because it reaches down to a lower age group, but also that's just the numbers that we've been able to get out. And on the right are partially vaccinated. Again, Pfizer a little bit more than Moderna, but again, probably because the Pfizer vaccine has been administered more in Mendocino County than Moderna. Does that answer your question, Matt?
Absolutely, very thoroughly. Thank you, Doc.
Okay. Thank you, Kurt.
Sure.
Thank you, Matt. All right, next up is going to be Danila with Mendocino Action News.
All right. Hello, thank you for having this meeting. One quick question that's not really a question, just kind of a statement. Now that we're in more of a surge and with the new changes in health orders, can we see more updates from Dr. Coren? Can the media have more one-on-one with Dr. Coren?
You know, Danila, that's a good request, and I'm sorry I've been more absent than not in the last month, but I've had some family illness that I've had to be taken care of. I think that meeting with the press and meeting with individuals is a very important part of my function, and that is to inform the community. So we're going to try and do that. I'm going to try and continue to do that as much as possible.
Thank you. We're trying to get an update on hospitals. I know that you said there's more cases there. You gave the number as of yesterday of how many are there. We're seeing in some reports that some hospitals might not have beds and that some people are even being turned away. Do we have an update on the capacity at our local hospitals? And can we get an update possibly from Adventist Health soon?
As you know, since this surge, or you may not know, the public health has been meeting with the hospitals on a regular basis, as we did last winter. And although they're having their major concern right now is the availability of staffing. So when we talk about just numbers of beds and the capacity of beds, we have to be careful that we're really talking about the capacity of staffed beds. And so far, although the numbers have been quite high, we have an adequate capacity, and the dominant reason in the ICUs or the dominant reason in the ICU hospitalizations has not so far been COVID. And the local hospital, Adventist Health Ukiah Valley, has opened up their COVID unit. So I think we do have capacity here. The ones who are being hospitalized out of town are because of acuity of their conditions, and they were transferred for a higher level of care. And they've gone to the University of California in San Francisco, Davis, and down in Santa Rosa, and one to Marin General. So far, our capacity is holding out.
Thank you. Do I get a second question since the first one was general?
Go
Sure.
ahead.
Thanks. I'm not sure if this was asked already, but we're seeing that there is a mandatory vaccines. I know, Dr. Coren, when we talked a while back, you said you didn't see that would be a possibility since it was still under, emergency authorization and experimental stages. But now we're seeing it with federal employees, airlines, healthcare workers, and even some schools and UCs. Do you see this entering into Mendocino County schools at some point?
It's possible. I think one of the changes is that the Department of Justice has said that it is legal. And that for public health reasons, mandates have been legal for a long time. If we look at mandated vaccines, it was interesting to read up and see that in 1777, George Washington required the troops to be vaccinated against smallpox. So it goes back hundreds of years. And so it's possible. Again, it depends on, how prevalent this is. And if we can't get it under control in any other way, then mandates, are necessary. We want to protect our community.
Thank you very much.
Thank you. Next up is going to be Dana with Mendocino Voice.
Hey, thank you. Thanks for having this update, everyone. My question is, in the beginning of the presentation, it was said that 88% of those hospitalized were unvaccinated, and I know there's been reports of younger cases being hospitalized, so I was curious, Dr. Coren, I know you had a meeting with the hospitals this week to address preparedness for hospitalized children. I want an update on that, and also how many children who are not eligible to be vaccinated have been hospitalized in this surge we're seeing.
88% of cases in Mendocino are unvaccinated.
Cases.
Really, the unvaccinated who are in the hospital are over 95%. I am not aware of any children being hospitalized for COVID in our county. We do have a pediatric hospitalist who is assisted by a locum tenens when it's necessary at Ukiah, at Adventist Health Ukiah Valley. And our emergency rooms know how to identify and stabilize patients. And if we're not able to stabilize a person here in Ukiah, and we don't have ICU beds, particularly for COVID pediatric patients, then we have developed some transportation and transfer protocols that are being looked at and developed and worked on daily. So I think we're capable, and the concern is there. We're seeing more. What we are seeing in Mendocino County are more symptomatic children. We've not gotten them to be severely symptomatic children or any who have required hospitalization. Does that clarify? Okay.
Yes.
Good.
Appreciate that. Do I get a second question as well?
Mm-hmm.
It was kind of two things on the same topic.
We're easy.
Okay, thank you. Another question I had is whether DPH is planning any new guidance or enforcement regarding gatherings and events moving forward. I know there's like pop-up, I wonder if the strategy is pop-up vaccination clinics and testing sites moving forward, or if there's anything we should be prepared for. I saw that there's a August 15th vaccine clinic at the Ukiah Concerts in the Park. There's going to be a testing site at the Days Between Festival. Not sure why a vaccine clinic wouldn't be also a pop-up there, but yeah, just curious if we should be prepared for anything.
Many of the event organizers, not all, but many of them have contacted me. And in the old days, they'd say, is this okay? And I'd have to give my permission. Nowadays, it's asking for advice, which is great because they're coming up with plans and they're very sophisticated at developing plans to protect their audience and the people who are coming there. And sometimes I'll give them feedback, and most of the time it's really excellent, and they're very, very concerned about it. I do think, I saw a picture recently of concerts in the park, and people were huddled close together and no masks and so on. Those are high-risk conditions. And so we're going to be starting to meet with the organizers again, more on a voluntary basis, and when we see these things coming up, but trying to get them to announce that social distancing and masking is advisable, especially for people who may be more vulnerable. I really would like to avoid shutting things down. It's not good for our people psychologically as a community, and so if we can encourage the people and the organizers in our community to take appropriate precautions, I think we have a good chance of turning this around without having industrial shutdowns like we did last winter. Last winter, people didn't know how to behave. We didn't know what the high risks were. And so it had to be done with more force and followed by education. And now I think there's a lot of education. We're just going to have to see whether the organizers and people who are participating do the right thing. And if they do, I think we'll see some good curtailment of these infections and hopefully no super spreader kind of events. That's my hope.
Okay, thank you. So, but clearly there's no plan for any new mandates or orders regarding it. It's just going to be case by case, working with the community and the organizers for these events.
Yes, that's right. Okay. No plans right now to shut down any industries, entertainment, or things like that. We want to see if we can mitigate the risk.
Thank you.
Okay, so we're going to take a couple questions from social media, and then I'm going to go back through the reporters one more time. So the first one is going to be from Facebook, and it is, can business owners make vaccines mandatory for their businesses?
Yes, counties can make things more strict than the state, and the state more strict than CDC. And business owners can, or cities can make it more strict than the county, and business owners can and venue operators can make it more strict than the county. But what each of us can't do at our tiers is make it less strict than the rules that we're under. And I would encourage, the next or the last of the three recommendations that I'm going to put into an order is to have human resource policies that people have to either be vaccinated or regularly tested and show the verification of vaccines or the regular testing. So we're moving toward that, hoping that there'll be enough time in the next month and an initiative on the part of business owners to write those policies, let their employees know, and then let's get it on.
Thank you. I have another one. How are vaccine numbers collected, getting vaccinated out of the city/county, etc.?
So every person who receives a vaccine, either from the county, from a pharmacy, from one of the clinics, has to give a certain amount of information that goes into records that are part of a program, a couple of programs, but a main program that's in our state called CARES, and that's I can't even remember what the name of it is, but it's CARES, and we do that in order to find out that the numbers that we're actually administering, and to understand the demographics, the male-female ratios, the ratios of people of various ethnicities, the ages, and so on and so forth, so we can figure out, well, what are we doing right, what are we doing wrong, and how do we make it better, and target those interventions. So CARES is the program. It's not the only program in California. There's a couple of others that they use in Southern California, but this is a program that's been developed for all of the vaccines, including childhood vaccines, goes into that into that program. And medical providers have access to that. And anyone who has been giving out COVID vaccines is required to report to that.
Thank you, Dr. Coren. All right, I'm going to run through the media one more time. Sarah, would you like to go first?
I think I'm all set for the day. Thanks a lot.
Okay, thank you. Matt?
Sure, thanks. My question has to do with reports that one of the recent COVID-19 fatalities could have been a breakthrough circumstance. And I'd love some coaching on the right language, Dr. Coren, because I also don't want to dispel vaccines efficacy. So yeah.
Yes, one of the people who recently passed away did have a full, well, it was one Johnson & Johnson vaccine. So that was a very, very unusual case. That person had also huge comorbidities. And it's, I'm not sure whether COVID was a main actor in the reason for that person's passing or just a sideline, but that person had huge comorbidities that were at least in part responsible. But yes, that's true. We did have one breakthrough death.
Thank you, Doc.
But from the language point of view, it's a post-vaccination case, not a breakthrough. Because there will be some who will get very sick, but it's extremely rare.
I believe the CDPH guidance is post-vaccination infection.
There we go.
Thank you.
Danila?
Hello again. Okay, so my question has to do with boosters. We knew that Pfizer is already starting to work on it and announced that, and now Moderna. They're talking about the efficiency wearing off around 6 months. Do you have any more information to elaborate on that?
What I've heard through the CDC and CDPH is that there is no evidence that its efficacy is waning. Clearly, the companies have a secondary gain if they do get the vaccines approved for boosters. But the way that we measure waning immunity in the lab may not be the same and may not be pertinent to how it is clinically among populations. And so as far as the following up that the CDC and CDPH has said is that they're not seeing a waning of the efficacy. When they do talk about those numbers, they may talk about the waning of immune globulins, but immune globulins are only one of 3 different methods that the body uses to fight a viral infection. So there's immune globulins, there's memory cells, there's cellular immunity, and so and a lot of that is not clear how they work together. So if you're just measuring immune globulins, they may see a decrease, and some of the research does show a decrease in immune globulins. It's very hard to interpret what that means. So when we look at it actually in the community, it's one of those things where the proof is in the pudding. And at this point, the CDC and the FDA are saying, well, we're not seeing waning immunity yet. And when we do, then yes, there may be a need for boosters. And most importantly, I think, is that we get a booster that is really specifically aimed at the Delta variant, which is our biggest threat right now.
Thank you. Thank you.
Next up, Dana?
Okay, thank you. Last month, Dr. Doohan held one of the COVID Media Day updates, and she had said that the county wasn't currently recording fully vaccinated people who test positive but are asymptomatic. And I just wanted to clarify that with you, Dr. Coren, with the evidence coming out that now fully vaccinated people can become infectious and spread the virus. I was just curious if you are now counting that, if I heard that unclearly, and if not, why not?
No, if anyone who has a positive test for COVID, we're contacting them with our CICT, and we do count them.
Okay, thank you.
Just for clarification, I believe what Dr. Doohan was speaking to there is on the graph that we showed earlier about the post-vaccination infection rate, that's only for symptomatic folks. We weren't including asymptomatic folks in that graph. Asymptomatic folks are captured in the CalReady system and they go through contact tracing. But as far as including them into our charts, we're only looking at those symptomatic cases thus far.
Okay, so just to be clear, the slide you showed was based on that measurement, but the daily case count is including those cases.
Yes.
Okay, thank you. That's great. Can I have, okay, I have one other question from one of our readers, if I can. She asked about this, one of the orders, when it's finalized, what are the county's plans to enforce when employers do create policies to have their have universal masking and potentially do this HR policy for vaccines and testing? Who will be responsible, she asks, for enforcement so that the service industry has someone to call so that our precious servers and essential workers aren't put in a position to be bouncers and doormen while just trying to do their job. So I guess they're a little concerned about having support around speaking with the public about the new mask mandates.
Well, I don't want someone who is refusing to wear a mask necessarily approached by a police officer or a sheriff who has other very important work to do. I think that has not worked well in the past. What we do want to do is we want employers and so forth to develop the skills to remind people, educate them, have the masks available. And the enforcement should be education, and usually in the vast majority of cases, education, reminding, having the mask available, saying this is what we do in our place, this is my establishment, no shirt, no shoes, no mask, we don't serve you. And that should be the level of enforcement that we need. I think making it a criminal offense is taking resources away from our other agencies, and I don't want to do that. We may resort, and I'm trying to write this under an urgency ordinance for the county so that it would be a fine that is served rather than a misdemeanor where it has to be served by law enforcement and the risk is imprisonment.
Thank you.
Thank you. I'm going to take two more questions on social media. The first one is going to be, when do you think we'll see a vaccine for kids?
Very good question. So my understanding is that Pfizer and possibly Moderna shortly after have put in requests for emergency use authorization for the group between 5 and 12 years old. And my hope is that that'll be out in September or October. And that would be around the same time period that Pfizer and Moderna will probably have their full FDA approval rather than needing to go by an emergency use authorization. So that's the timeline that we're thinking of. The younger children under 5 may take another 6 months or so. I don't have more information on that.
Thank you. And then also another question, with the current surge, are there any concerns of availability of the vaccine or tests?
You know, at this point, we have more than adequate vaccines. And as I understand it, the federal government is prepared to buy more and distribute them more. Our problem in the last couple of months has been insufficient demand. And that's been our biggest obstacle. As far as testing, we have testing available through the county, and it's these resources are also subsidized so that there's no need for individuals to pay for them. So yes, we have enough testing resources as well as vaccine.
Okay. I'm going to run through the media one more time if you have any last questions. Keizu X and Z.
Nothing comes to mind. Thanks a lot.
Okay. Matt?
No, thank you.
All right. Danila?
Yes, I have a question from one of our readers, also through Ukiah Chamber. They would like to ask, is there going to be any changes regarding masks at tables or deli places, such as some of our local restaurants or cafes? I know that you're saying that you're requesting that masks be worn inside. Does that, affect restaurants and places that eat inside?
Absolutely, but I haven't found a way that people can eat through a mask. So what we're asking people to do is really just remove the mask to eat. What I see when I go to a restaurant is the masks come off when people walk through the door. That should not be allowed. That's what happens is then people are eating without masks. There are people walking around who can easily be infected, and so it's a much higher risk situation.
Thank you.
Thank you. And then Dana, do you have a follow-up question?
Yeah, I was just curious. One of the slides, it now says just says excluding prisoners. So I was wondering if the data we have now includes Veterans Affairs, IHS, and pharmacies.
We do have some access to that data. When I give the total number that have been dispensed within the county, that should include it. So it should be including that now in the numbers that I'm giving.
Okay, and do we know what percentage of emergency responders are now vaccinated locally?
I don't have that information, no.
Okay, thank you.
Alicia?
Let me unmute myself here. Can you hear me?
Yes.
All right, thank you. We do have a question from one of our listeners on KCYX who participates in a weekly indoor country dance event and is wondering if everybody is vaccinated. Is it safe to continue doing an event like that? I'm sure there are a lot of people in the county who are wondering if they can kind of keep their normal routines with others that they've started back up if they mask and are all vaccinated. What do you think?
At this point, if they're all masked, it should be reasonably safe. We may learn different in the future, but that would be an area that would be high risk, the same way we think of workouts in a gym where you're huffing and puffing. I know when I do my country dancing or any dancing, I huff and puff, and that's when we get rid of we put out an awful lot more germs. So masking is a good protection, and we'll just have to see how that works. Of course, people will be closer than 3 feet or 6 feet, and so it is a little bit more risk. It probably would be better for people who have immune deficiency diseases or are elderly to think twice about whether to engage in that kind of group activity. But I'm not going to say it's going to change at this point. Until we have information, I think we want the community to continue to thrive and just use the vaccines and the non-pharmacologic interventions to the maximum and see if we can head this terrible pandemic off.
She'll be happy to hear that. Thank you.
All right. Is there any more follow-up questions from the media?
I have one. This is Dana from the Mendocino Voice. Curious how we are going to enforce the state mandate for health workers and the mandate to get vaccinated by September 30th. Is the consequence that people are just going to be fired from their jobs, or
As far as the state mandate for healthcare workers, is that what you're talking about?
Yeah, and government employees, like first responders, government employees, healthcare workers, the list from the state of California. So
the ones from the state of California do not include first responders, emergency medical technicians, and law enforcement. And who will enforce it? I don't think that has been that clear yet. But again, hopefully it will not take heavy-handed enforcement and take resources away from police and sheriff's offices. And hopefully it will be a matter of education, making available the masks when they're needed, making available vaccines, and hopefully people will understand the severity of what's going on right now and go ahead and do it. Otherwise, the idea is that those who do not comply would lose their employment when it comes to certain things like that.
Thank you, and thank you for the clarification. I misspoke, so thank you.
Go ahead, Matt.
Thank you. One more question, Doc. I was wondering if you could talk about we've had a surge, rise of cases, hospitalizations and death. Are county vaccine workers, are we seeing an increase in vaccinations since this? Has there been an influx? Is it kind of remaining stagnant?
The numbers of vaccines that we're seeing go out, in the
Yes.
last week, we have seen more people show up at our vaccine clinics, and we're hearing from our partners in the clinics, the FHQs and rural clinics, that they're seeing significantly more people taking vaccines now. I think it's two things. I think they realize, or several things. They realize the severity of this pandemic. I think people are realizing that the vaccines are safe, that friends and relatives are getting vaccines, and that people who are vaccinated are protected. And I think that, people's defenses against the vaccines are coming down a little bit. In addition, on the other side are these new rulings that you have to be vaccinated or get tested. And who wants to get their nose swabbed, once or twice a week? It's a pain in the neck or in the nose. So people are getting more vaccines.
Thanks, Doc.
You had a follow-up?
I do. So there's a lot of confusion and some frustration in the community and some of our readers. You kind of briefly talked about this. You saw the concerts in the park, the picture with, several hundred of people getting a selfie. So they were even closer at that moment, probably.
Right.
And then you see the Delta variant that is maybe, affecting kids, not to the extreme measure of, extreme symptoms or in the hospital, but still it's spreading a little bit more with children. We're seeing that on the graph as well. And these events are still going on. So some of the businesses are feeling like, they're getting kind of punished. They're smaller, like a retail shop. Maybe there's 2 people in there. You see schools, kids are now outside. They're going to be maybe sitting close together while eating or playing, and they don't have to wear a mask while outside. So, I mean, how do we explain how kind of one thing looks a little different than the other?
I would like to be able to say this is a horrible disease. This is the way you can solve it, and everybody jumps in line and solves it. That doesn't happen in Mendocino County. It certainly doesn't happen in the United States. And I've never seen that happen with individuals in my practice. It takes time to make these changes. So we addressed them last year when we first came across COVID, with the whole population making, broad stroke kinds of interventions. I think that it's reason to be frustrated, but not to lose hope. The businesses that are going to be subject or recommend to make their own policies are not being punished. We're doing that to actually give them cover. And I can't tell you how many times I've been asked for this and thanked for it. So they can make a policy that the county stands behind and is encouraging them to do. It's protecting the business, it's protecting their employees. Remember, a small business who loses 1 or 2 employees, or 1 or 2 employees comes into a slightly larger business and they have COVID and they infect a larger workforce. That business, shuts down. They're really crippled. This is a way to try and keep people safe, not to punish. So we're giving guidance and recommendations, and we hope that people will take it that way.
Thank you. I appreciate that. Anything to add about schools outside? They're still not wearing masks. Is that still going to be even with the Delta variant?
At this point, outside is still very protective. And so we're not asking school children to wear their masks outside. We are asking people or recommending to people if they are in crowds and some people are not, are not vaccinated, or even because it can run among asymptomatic vaccinated people, it's good to keep distances. So the social distance within the concerts in the park would be great between not just each person, but groups of people. People come and they sit in groups because they know their families or the people they are with are vaccinated and feel safe there. But at least between those groups, if they could maintain some distancing, that would help. And these are the kind of changes that I'm trying to encourage people to make. And it doesn't have to be that we have a school guard or a concerts in the park guard walking through and saying you're too close. People should understand that they should spread out some more, and maybe with guidance from the stage and making some changes in the where the speakers are put in the stage and the dancers, that we can have a safe concerts in the park.
Thank you. I appreciate that.
All right. Well, that sums up today's COVID-19 update. Thank you for joining us. I'd like to give Dr. Coren an opportunity to give his concluding comments.
Well, I would say I think everybody knows now that this Delta variant is a new disease and it's very contagious and it can cause a lot of havoc. It's mostly going through the unvaccinated community, and the best prevention is vaccination. We don't want to be heavy-handed in our ways to control this infection, but we're getting a little bit more targeted with healthcare workers and other emergency personnel. And for generally, masking should be one of the layers of protection. So even if you are vaccinated inside, wearing a mask makes sense. And if you're more vulnerable, wear a mask outside. And everybody should be learning and following the guidance that they've already learned from the last year to protect themselves and their loved ones. And I think that with that, I'm hoping that we will get through this without major shutdowns of the economy, of the commercial sector, of recreation or schooling. That's what my thinking is at this point. So we'll move forward together, and we'll try and keep that spirit up.
Thank you, Dr. Coren and members of the media. Our next update will be scheduled for August 20th. Please continue to follow Mendocino County Public Health on our Facebook for all COVID-19 updates. Thank you, everyone, for joining us, and have a good weekend.
Thank you.